Hi, Dr. Weismantel. Thanks so much for joining us today to answer some team member questions about safety in the residence halls and the dining halls for fall. We appreciate you taking time out of your busy schedule to do that.
Oh, thanks for having me.
Always pleasure talking with you. I know that a university physician may not be a role that people understood that we even had. Can you tell us a little bit about what your job is at MSU?
Yeah, just very briefly, probably most important for this, the university physician is the public health officer for the university, doing a lot of coordination with the public health department and making sure that from a medical standpoint, we're keeping in line with all regulations that are needed to keep our faculty, staff, and students safe. In addition to that, I mean, the university physician here uh, has oversight on occupational health and food sanitation, which we actually help RHS a lot with, the employee assistance program, health promotion, and a travel clinic. So it's a mixed bag of things, but for what we're talking about, the most important part is the public health officer portion of my job.
Great. And you've been helping all along. You've been coordinating with Venny and the rest of the RHS emergency operations team to make sure that we're doing all the right things to keep people safe. So I've got some questions that some team members have asked, specifically related to our role in quarantine and isolation housing of students this fall. So I just got a couple questions we'd love to ask you.
All right.
All right. So what is the difference between quarantine and isolation? That's a little confusing. Can you help us?
All right. So quarantine is a word we use for um, setting people in their own housing who have potentially been exposed or who have been exposed to somebody with coronavirus or COVID-19 in this case. So it's that they've been exposed to that person and has been identified, either they have identified themselves or a public health official has told them that they are considered to be a close contact of somebody with the virus. And typically, quarantine is for 14 days. And I will add also, and that exposure may be coming, just be as general as coming from a place such as a state that has a high incidence of coronavirus, such as at this time, Florida. So if you're traveling to Ingham County from Florida, it is strongly recommended that you quarantine for 14 days before interacting with others in the county.
And so then what's isolation?
And then isolation is a word that we use for separating people who are sick or who have been diagnosed with COVID-19 from others. So this is a group that has symptoms or has tested positive. So they definitely are of higher risk to others than a quarantine population. Quarantine population, we're watching to see if they develop symptoms. In the isolation population, they already are either being tested and waiting for results because of their symptoms or have tested positive already.
Okay, thank you. So we know that we're going to be isolating students in Acres, in the Kellogg Center, and in Spartan Village. And what sorts of things do you want people to know about the housing that's happening there?
Yeah, what I'd like people to know about the housing that's happening there is that people in both quarantined and in isolation, the idea and the direction is that they are to spend a majority of their time or the preponderance of their time in their room, isolated from others. And that for the quarantine population, perhaps they might go down, pick up a meal, and take it back to their room. And that would be their entire time outside of the room. Other reasons people in quarantine might leave is if they actually had an important medical appointment that they couldn't accomplish online. But really, that they are to spend the entire time in their rooms and not interact with others or even interact with each other, because that really doesn't fit the definition of quarantine, and keep even the people that are in quarantine safe from each other.
Interesting. That's good to know. So if someone is really sick, Is this where they're going to be?
If they're really sick, likely they are not going to be here. They will likely want to go home. Or if they're very sick, they would be evaluating the emergency room and perhaps be hospitalized. This is not an area that we would consider as like a medical care unit where we're having, doctors visiting regularly and medical care happening and IV fluids or any sort of medical care that would be occurring in this area. It is meant for people with mild illnesses, which most young people with COVID-19 have mild symptoms,
Mhm.
or those that are asymptomatic or are quarantined, just waiting to see if they would develop symptoms.
Good. How should team members protect themselves from contracting COVID-19 in general and in these environments?
In general, it's going to go back to our basics of wearing a face covering or mask at all times when at work and when indoors, social distancing at least 6 feet from all other team members and or students. Uh, Occasionally, we may break that 6 foot barrier in order to hand somebody something, but it's really not spending any prolonged time within that 6 foot bubble of others and practicing good hand hygiene. Those are the basics of continuing to keep ourselves and others safe. In addition, for those working in the quarantine isolation areas, we've discussed, and it's probably a good idea for them to wear face shields when working in those quarantine isolation areas, which can be an added level of protection for the eyes, particularly. And it's probably even an added level of protection for others if you would happen to have symptoms, not being able to transmit the virus as easily.
And so tell us a little bit about contract tracing. So when someone gets sick, we're told to isolate them, and then we're told that contact tracing is happening. How is that happening? Who's doing it? Who will they be reaching out to?
Yeah, contact tracing, it depends upon how the diagnosis is made, where the lab results go. Many of the lab results have done at the university. Um, uh, my office as university physician will be notified. And we reach out to the person with that diagnosis pretty immediately, as if it happens during the workday, if the next morning, to discuss with them in the 2 days since they became symptomatic, before they became symptomatic, and up till their current time, who it was that they had close contact with. And we do that for everybody within our campus population. And close contact is defined by the CDC as not wearing a mask and being within a 6 foot bubble and spending greater than 15 minutes. And not being a contact would be wearing a mask, staying 6 feet or farther apart, and not being around somebody for 15 minutes or more. And so there's some in between there, like maybe if you spent 5 minutes with somebody 4 feet away with a mask. And these are the questions. If there are any of those, we collaborate with the health department to determine whether that person would be considered a close contact or not. It is not simply being in just the presence of another person in the same room. And that is why we are able to reopen our campus for some educational activities with mask wearing, face coverings, and the social distancing, because the virus is much less likely to transmit if we're taking those precautions. So the contact tracing is finding those that possibly the virus could have been transmitted to. But if we follow those precautions, as we've experienced over the last 4 months, most people will not be considered a close contact and do not develop an illness.
Good to know. Can you tell us more about the overall campus testing plan? Who will be tested? How they'll be tested?
the overall campus testing plan is in collaboration with the MSU Healthcare. There will be at least 1 or 2 sites on campus where faculty, staff, and students can go to, that have symptoms, can go to just have a test. And that is we're going to be able to do at least hundreds of those a day if needed. Also, students are able to come to Olin with an appointment with maybe more significant symptoms and get a test at Olin. And that test, the turnaround time on that is within a day. And we're usually, for the other testing on campus, it's likely to be within a day or 2. We're trying to keep all of our testing, have worked hard to develop ways to procure testing that we can get the results back within a day or 2, which really helps with the contact tracing efforts to decrease the transmission. So the testing, there will be, over the next 2 weeks, a lot more testing availability right on campus for faculty, staff, and students. And in addition, they're right now piloting some surveillance testing that will be available to faculty, staff, and students. That will be a randomized sample of those that would like to participate, and that will be a saliva-based sample. And more information about that will be coming. But what I do know about that is people would be there will be an invitation to participate going out where you register, and then after that, you would be notified on any specific week that it might be your week to do a random surveillance test. And that surveillance testing would lead to a result that might tell you to go get an official test, or to tell you that you don't need to go get an official test. So a couple of ways that the campus will have significantly increased testing capacity within the next week or 2.
Well, thanks so much, Dr. Weismantel. Is there anything else that you would want team members to know or do as we move into fall?
No, I think the only thing I'll do is just reiterate the importance, like if we follow the face covering, social distancing, and hand hygiene, really the virus has a very difficult time transmitting under those conditions. And that's the most important part within our normal work environments or within the quarantine isolation spaces. Those are the same precautions that they're taking just in the general healthcare area, in the general hospital areas, almost the exact same precautions that are taken there. So I think that's the most important thing that I would like to reiterate at this point.
Thanks so much, Dr. Weismantel.
You're welcome.
Appreciate you answering some of those questions. If people have further questions, where should they go to get more information?
Right at this time, probably the best thing to do is if they have medical questions, to reach out to their own providers about specific medical questions about what specifically is happening in RHS, to reach out to their RHS supervisor or others within RHS. And if it's more about the campus reopening project and what's going on there, they could send an email to reopening@msu.edu. And I think that would be the best way that you will get a response to the specific questions.
Perfect. Well, thank you again. And we're looking forward to fall. I think people are a little nervous, but at the same time, we're excited to see people back on campus and see our students again.
Yeah, thank you.
All right. Well, you have a good day.
Thanks. Bye now.